So if you're watching this, you're relatively new at the clinic, and you may or may not know this, but our goal is to reach as many people as possible in the region. So I wanted to let you know how you can refer into the clinic, because I do find it's a difficult process. Even for patients who are here, they're getting amazing results. Well, it's often a challenge to send a spouse, a partner, a colleague, someone else into the office you know who's struggling. A couple times a year, we always have events where we will waive the consultation fee, usually Christmas and summertime. But what do you do between those? Like, I never want people or patients to be sick or struggling or suffering, knowing that there's help right in Ottawa's Bayard market for them. So the reality is, guys, it's going to take you stepping out of your comfort zone and being adamant that people get checked. If you now understand a little bit about your spine, the mechanics, damage that happens in a spine, how your nerve system gets affected, chiropractic is so much more important than just waiting for someone to throw their back out or wait till their headaches become migraines and then go, hey, I know a great guy who might be able to help you. Why don't you go get an exam? The reality is, if you have a spine, you should get an exam of that spine. Any age. I'll say that in the last 6 months, my two worst, and it breaks my heart to say this, my two worst spines have been 14 years old and 17 years old. I get some pretty bad ones in the 60s, 70s, and 80s, but spinal damage can happen at any age. Subluxation can occur from the birth process on. So that's why it's important. It's not just waiting till things start getting worse or the patient's really struggling, that person's struggling, to send them in. So my goal for you is at least once a month, target someone who you know should have a spinal exam. You may notice bad posture. You may notice a limp. You may notice them complaining about back pain or headaches, kind of the regular chiropractic stuff. But now that you know a little bit more about the clinic and how your spine, your muscle system, your nerve system, like, literally have to work at 100% for the rest of your life in order to keep you healthy, well, I want your partner healthy. Like, I want to meet them. I want your colleagues healthy. I don't want them knocked out of work and calling in for sick days because of musculoskeletal stuff that chiropractic can help with. So here's the thing. You're surrounded by people who need help. Statistically, every single one of you knows enough people to fill a yellow school bus. Like our kids' yellow school bus. Again, statistically, a quarter of those people are looking for answers to their health. They're sick, they're suffering, they're struggling. So what is it going to take to step out of your comfort zone and say, you know what, I've learned so much here, I think you should go in and get an exam. Well, I feel perfectly fine. Well, it's not just about how you feel, it's about using the data on your health to ensure there's no dis-ease or a disease process in action in the spine. There's no pressure, there's no tension, there's no static on the nerve system. So it's a really tricky video to shoot, because I do find a lot of patients come here, they get absolutely amazing results, but it's always a bit of a step out of the comfort zone to actively refer in people who need help. So that's my goal for you. As the weeks, months go on and you get better results, share, post them online, share with friends, family, colleague. Try and get people checked, because at least if they have the right exam and, if necessary, the right imaging, then they have a whole bunch more information about their health. And at that point, they can decide what they want to do about that. All right? Thanks. Take care.